Ria and Carla are working in a community hospital and are going to demonstrate some of the equipment they use when they're supporting the patients in the hospital ward.
Right, what we normally do in hospital is some people can't transfer very well. We use certain types of equipment, so we're just going to show you people how to use them and what sort of equipment we use. This is called the stand and hoist. I have to put my feet onto the foot plate at the bottom. I have to just make sure everything's in a safe position. This is the belt which goes around the patient. And it comes in different sizes, like you get yellow, which is a small one. This is a large one for me. And then you have to do this complicated bit where you have to wrap this into here. So it's secure in position. Then you have to pull it tight, so you're in a good sitting position. Then you normally have to ask if the patient has trouble to hold onto the grips here. They normally wouldn't do anything for themselves, they just stand up like this. You just make sure they're okay.
Are you okay with it?
Yep, thank you. And then you make sure their feet are the edge of the bed. That's it. And again, you have to release these again, so if the patient comes back a bit. And they remove the belt and take the hoist away. You normally get the patient to ask to hold on to the side of the bed. Then we're going to transfer me back into the wheelchair with a Samhor Turner, which is for more mobile patients who can actually stand up for themselves, but you still need quite a lot of assistance with this. And then you put the legs in the same position as before, really, so your knees are against these foot plates. And then different opinions about where you put the arms. You should really ask the patient to put one arm on the bottom, one arm on the top. And then you have to ask them to stand up for themselves. You don't really push them up, you have to ask them to stand for themselves. They should be okay to do that. Then you have to keep your foot on this brake here, so it actually steadies the patient. You have to get them in position. Then ask the patient to sit down. That's it. And then they normally take that away. And then you always have to clean the equipment after you finish with it as well.
Once they kept talking, I don't think she'll stop. My name's Martin. I'm one of the supervisors for the apprenticeship scheme here at Abingdon Hospital. So far, the apprentices that are with us now have been fantastic. Two of them have gone on to become full-time healthcare assistants. And currently we have Ria, who's working her apprenticeship through with us at the moment.
It was an amazing experience. I had 2 placements. The ward was my second placement and I enjoyed it, and I got a full-time job here. And I'm a healthcare assistant, which is amazing because you actually get to make a difference, which is like what my main point of life is. And you get to look after people, which two birds, one stone, which is good.
I'd just like to say that we're really proud as supervisors of what they've achieved, the apprentices, since they've been on the ward. They're a credit, they really are.
I like interacting with the patients and building up relationships with them. Before I started the apprenticeship scheme, I was a volunteer for Bernardo's and for a youth centre.
In the future I want to start my MVQ3, but I'm giving myself a chance to improve on my skills and knowledge before I start my MVQ3.
Mainly I want to be a nurse in the future, so it's a good stepping stone because you actually get secondments here, which is amazing, and it gives you that stepping stone in life so you can actually go up.